abhorrence, I think. We spent billions of dollars on the healthcare system, and many of you I know have been involved in that. You know, it's one of those subjects you're not really allowed to talk about, but I will anyway. I think the feeling was quite strongly that there was not enough physician or clinician involvement at the beginning of the program, that there was not enough consideration to local issues, and there certainly wasn't enough consideration to the issues of individual liberty and freedom. And strangely, as in America, individual liberty and freedom and understanding who's got your data is actually quite a sensitive issue in Britain. It's a sensitive issue, in my opinion, for the very correct reasons. We are a nation state, as you are, who strongly believes in the rights of the individual. And to have a system which you could imagine overnight, 60 million people's records would be freely available to anybody, is frankly absurd and should never really have been countenanced in that way. Once you begin to break it down and you say, well, do you mind if the hospital have your records? That's okay. You've also got to remember, the National Health Service is run by the government. This means the government has information on every single individual in the country. Now, you know, you hope your civil servants are reasonable, you hope your politicians are reasonable, but I don't think anybody really fully understood the implications that that would have in a political context, but not necessarily in the UK. It wouldn't be voiced, but there would be solid, sort of guerrilla-like resistance to it, and that's exactly what has happened. If something doesn't happen, the majority of people in the system won't say, oh, it's wonderful that the electronic records don't work. Nobody will say that. But underneath, they'll be thinking, well, that's okay. Maybe it's gone a little bit too far, and, you know, if my GP knows, then... And the other thing you've got to remember is that when you sign on to a GP locally in the UK, that means every single person lives within 2 miles of the GP. GPs employ receptionists, they employ nurses. Everybody knows everybody else. Now, once you've got an electronic patient record, and your GP knows, and you can only ever get to see your GP every now and again, that means that the nurse knows, that means that the receptionist knows, and their partners are going to know. So the chances that your records are genuinely secure is next to zero, to be honest with you, next to zero, particularly if something is wrong, and particularly if something is scandalously wrong, by the way. So those issues have never really been addressed fully in the UK, but underlay a lot of the resistance. And the other was the medical, not engaging with the medics, and so, as we were discussing earlier, it's just another damn thing to do, and I've got a clinic to do, I've got the real work to do, and so on. So I think both of those two things clashed in what has been a stupendous spending of money.
Maybe one more question, if there is one. Okay. Yeah.
It's more than a casual observer of what's going on.
Indeed.
I just have to say how much I appreciate what you as a government are trying to do to change the game.
Mm-hmm.
All the issues, as you said a moment ago, they're universal.
Mm.
In every country in the world, they struggle with the same healthcare issues. They're all trying to solve many of the same problems. But I think whether Tony Blair, Mr. Blair, or Mrs. Thatcher, whoever deserves the credit, really had a vision and had a macro view of what might happen to really transform here. And I think Britain could well be the example for us all before we do.
You know, to your point, one of the things that I'm experiencing as I travel around the world now is that if I go to China, India, Australia, Middle East, whatever, is that they are looking to two countries as the examples to learn from. They're looking to the United States and for some of the positive things that we've talked about this evening, but they're also looking to the UK and the ability to treat a whole population. And the lessons learned from those two countries are becoming the lessons that all of the world is looking at, trying to figure out, okay, so how do we go forward as our economies develop, as our people begin to demand, very rightfully, demand excellent care, excellent services, because as we were talking about earlier today, all societies, when they start to get their economies rising, begin to turn towards what are we going to spend our resources on, and healthcare becomes one of the primary topics, along with education and a couple of other core areas. So it's going to be an interesting challenge as we move into the future. Stephen, thank you so much for coming to the United States. Thank you for sharing your thoughts. Really appreciate it. Thank you very much.
Thank you.